All right, welcome friends. We are on the Barriers and Breakthroughs show, and I am Rochelle Payne-Baum, your pain whisperer, and I'm a physical therapist. And in fact, I have a new prop to show you today. So, can you read that? You see that? It says physical therapy. So, I'm official now. Like, I'm actually walking the walk of the shoes of a physical therapist now. No, it just helps me with my job. It's fun. So, but yeah, so I've had a great week, and any of you that have pain out there, I'd love to help you fix your pain. And just you can message me on Facebook. A good physical therapist helps somebody fix themselves and teaches them how to fix themselves. So that's what I love doing. So if you have pain out there, you can message me on Facebook. If you have my cell phone, you can text me, but I've been able to help people out there that got hurt working out, tried to be a weekend warrior, and have questions for me. My family calls me, asks me questions. I love that. I love to help people fix their pain. So I'm so glad that you're joining us tonight because we have an awesome guest, and this is Rebecca Maxwell. She goes by Becca, right?
Yeah.
And she is super, inspiring for me because she does powerlifting. And so actually we became really good friends in the gym. And so she's actually training me. So I'm going to do my first powerlifting competition this December. I said it, so I better do it right now that I've committed.
Yep, that's it.
So tune in for that coming up in December. But thanks to Becca, she's a very strong person in many ways, and spiritually and mentally and physically. So I've been learning a lot from her. So I'm excited to have you on today.
Thank you.
Thanks for being on. And she'll tell us a lot of great things about psychiatry and what that entails. I want to just show you a quick video just to show you what kind of a person she is, because she's a very diligent, intense person. So we're going to start out by showing her deadlift. I videoed this in the gym, and how much was this? I don't remember, like 285 or something.
275.
275.
Yeah.
All right, let's watch the video. Got it. Go. Go. Got it. Go. All right, that was awesome. And you notice probably a lot of people cheering her on because that's how she is. She just excites people to have her reach her goals. So anyway, so we're having a good time. So tell us a little bit about your story.
Okay.
Why you became a psychiatrist. And
all right. Yeah. So, well, when I first decided to go to medical school, I really thought I was going to be like a family doctor or some kind of primary care doctor because that's all the exposure I'd ever had was going to the primary care doctor. Psychiatry didn't even enter my mind. Like I didn't see psychiatry like as going to medical school and being a doctor.
So you want to be a doctor?
Wanted to be a doctor. So then I go to medical school, and when you're in school, you get exposed to all these different specialties. And so when we got to behavioral health and psychiatry, I was so fascinated by the information that I read like all the books like ahead of time, which I didn't do anything else.
Wow.
So that was my first clue.
Go-getter there.
Right. So just because I was so interested in it. But I think, I did consider several different things in the end, and I think ultimately I chose psychiatry because for me, when I was learning about the different specialties, this was the one that seemed like it was the most holistic because you're really kind of getting deeply into everything about a person's life when you get to know them as a psychiatrist. And like a lot of the other specialties, they just focus on how's your leg feeling today,
one specific thing.
And so that really, really appealed to me. And so after giving it a lot of thought, and realizing I had to put my stethoscope away, I went into psychiatry, which
Wow.
was definitely where I need to be.
So what does that entail as far as you go to medical school? So a lot of people probably don't know, I mean, how difficult it is. So you do 4 years of medical school,
Mm-hmm.
and then
And
residency?
then, yeah, so whatever residency you choose, there's varying lengths of time they have to train, but for psychiatry, it's 4 more years.
So it's still 8 years of schooling. Wow.
Yeah.
Yeah.
So.
Okay. So did you ever, I never worked with a psychiatrist as far as me personally. Did
Mm-hmm.
you have any interaction with psychiatrists that really taught you or mentored you or really inspired you?
Well, I mean, anyone in particular, I would just say at Baylor, all of the attendings that I worked with there, and even there was a resident that I'm thinking of that I looked up to a lot as people. They're incredibly smart. They're very caring about the patients. They actually spend a lot of time with patients and getting to know them, and so they were just, I don't know, they were the kind of doctors that I thought I wanted to be. So
awesome. So does your family ask you a lot of like advice or like I need a lot of help or?
No, not really. They think they don't think I know anything.
Oh no.
My friends sometimes will ask advice though, but no, my family's like, don't psychoanalyze me.
Yeah. So you were having a family also while you were in medical school, right?
Yes.
So.
I don't advise that. Fair enough.
So you're an awesome mom. I know we have a few pictures of you. Like, I think the first one is with your boys when they're little. It was Halloween. That's a really great picture. And then the next one is when they got baptized, right?
Yeah, that's right.
So tell me a little bit. You had a spiritual kind of change, and how did that affect your practice, maybe, or your view on life, or did that make a difference in how you treated others?
Yeah, I mean, 100%. So, I didn't really grow up going to church or having any kind of spiritual identity, whether it be Christian or otherwise. My parents were just that was sort of an absent thing in our lives growing up. And, I reflect on some of the choices I made in my own life and some of the things that I felt like were missing. And then when I had my children, I think that's really what instigated me to say, I want them to have some sort of guidance there. And so that's when we started going to church, and we went to an Episcopal church, which we're still members of. And it did change, not so much that I think that someone has to be a particular faith or one way or the other, but that our spirituality, that part of our being in our life, is so important for your overall health and wellness that it's actually literally included into my thought process about what makes a balanced person. So you have mind, you have body, you have spirit, and then you have what I call your tribe, which is your people. And so all of those have to be in balance and healthy for people to be completely healthy. So
good.
Yeah.
So you we also have a picture of your boys now. They're older, and you made it through the teenage years. Somewhat makes me speak louder.
Sort of.
Yeah. You have that picture up? Yeah, they're just so cute and handsome. I know both of them, and so I just think they're super great. So, how have you been able to teach them better? Maybe because of being a psychiatrist, or
well, I mean,
how has that helped you?
I think it's actually helped
as a mom.
I don't know if it's helped them. It's definitely helped me because, like I learn about the stages of different development, in my training, and so when they had the terrible twos, I could sort of actually sit there and think about, well, why are they doing this right now at this stage? And then as teenagers, when they start acting out and rejecting everything that you stand for, you realize that that's actually healthy. So, you can accept it a little bit better.
That's really good information. Like, if you didn't realize that that's normal, like you would think like maybe you're a bad mom, right? Because they're not. I think a lot of parents become really controlling because they think they can't control their kids when that's kind of a normal thing, right?
Yeah, and it's actually, you know, when they're being the most annoying as teenagers, honestly, that's, you know, you can view it as, well, it's a time in their life when they're supposed to separate from you.
Become independent.
So they're going to become their own person, and the only way they can do that is to push you away. So
it's a normal, healthy thing.
It's a good thing, yeah.
And you can still build on your relationship together.
Yeah.
In a different way.
Yeah. So, I mean, and these are, I'm talking about pushing you away in normal ways, not going to extremes, but.
Yeah, just trying to show their independence and make their own choices, right?
Right.
Yeah. So tell me a little bit about, you specialized in integrative medicine. You were telling me a little bit about that.
Yeah,
Yeah, explain who helped you with that, because I think, you know, we can show a picture. But speak louder too.
So that's a long story, actually. So medical training is, you know, it's basically after high school, you go through 12 years of school.
Yeah.
And especially medical school and residency, you're spending, at least if you're me, you're spending most of your time just trying to absorb as much as you can of the information and make sense of it all and survive. And so that happened, and, you know, you get through the training, you get indoctrinated in the, you know, Western model of medicine. And then when I went out and started practicing, questions started to rise in my mind.
Like what? What kind of questions?
Well, you know, a patient would say, well, you know, why exactly do I have depression? You know, and I could give them some kind of answer like, well, you know, maybe you have a family history, or maybe this, or maybe that trauma in your life caused it. But really, we don't really know. So, you know, am I going to have to take this medicine forever? What does the medicine do exactly? So there's so many things that we don't really fully understand.
Mm-hmm.
And there are also illnesses that we don't have any idea what causes them or how to treat them. Some examples of that would be chronic fatigue syndrome.
Yeah.
A lot of cancers, we don't know why one individual gets it and another doesn't. What we call idiopathic hypertension, which is high blood pressure that most people have. They call it idiopathic because they don't know what causes it.
Yeah.
So, you know, those things started really bothering me, and I realized that, you know, although I learned a lot and I learned lots of ways how to help people, there were just these things nagging at me, like, what, you know, can we look for something deeper, something underlying, something that, you know, is actually contributing to the illness continuing or getting worse or not responding to the medicines. So through a long journey, I finally landed on the concept of integrative medicine. So there are a lot of different schools of thought out there. There's functional medicine, there's integrative medicine, there's some old style approaches to things like homeopathy, and then there's chiropractic and all these other approaches to helping people that through my training we really didn't pay a whole lot of attention to, and in fact sometimes kind of push it away.
So it's not only in psychiatry, but it's in all of medicine.
All of medicine.
Okay.
Yeah,
got it.
So, you know, being more holistically minded, which is kind of what took me into psychiatry to begin with, I started searching. So I found integrative medicine. I like that the most because basically the concept behind what it is it is trying to take the best of all worlds. So it's not a complete rejection of, you know, what we learned in all of our years of school, but it's also not a complete rejection of some other approaches.
Like Eastern medicine type thinking?
Yeah,
not
exactly.
just only Western, like energy kind of.
Exactly, yeah. So looking at all of those things based in science. So basically you're not just going to wholeheartedly say, yes, this works with no data.
They're doing studies.
So you're going to look at it and, you know, determine, can these things hurt people? You know, are they safe? And then, you know, being open to trying different things with patients.
So Dr. Weil, we have a picture of, was he the father of integrative medicine? One of the founders?
Mm-hmm.
And so you actually got trained by him. You have Dr. Weil up there?
Yeah.
In Arizona, you said?
Yeah, so he started the first integrative medicine fellowship program or training program, and now there are many of them throughout the country, but this was the original one. He still teaches there, and as well as a lot of other faculty. And the good part about it for me was that it's mostly a distance learning 2-year fellowship.
Wow. You were there 2 years.
Yeah, so I did online training,
Online,
and then we would go on site. We went on site for week-long trainings 3 or 4 different times.
So you actually get certified, or?
Well, you can get board certified. I haven't done that because it's training in all the different specialties, not just psychiatry. So I could do that, but I haven't done that yet.
You just focus on the psychiatry part.
Mm-hmm. Yeah. And you have to pass a final exam to get your completion certificate, which I got that.
Very cool. Mm-hmm. So tell us, so you've done a whole different variety of work in hospital work. So what kind of experience do you have, and then what are you planning on doing?
Yeah.
So
that's kind of a twisting journey as well, but to try to make it a slightly shorter story, up until I guess a month or 2 ago, I have been working in a variety of different settings. So I was the medical director of a hospital and a partial hospital program that treats a lot of severely mentally ill people, mostly diagnosis like schizophrenia. And
do they stay in the hospital, or
they go in and out of the hospital? Yeah. And then I worked at some other programs. Then in 2009 I opened my practice here in Pearland, but it was always really, really small and really, really part-time. But I kind of had the goal in mind eventually to commit all my energy to it. So now's that time. And
You're
so
ready.
I took the leap. I feel like I'm ready to practice integrative medicine the way I want to. We're excited. We're getting ready to move. I've got some nurse practitioners. We have the right staff in place. And so I'm just diving right in and doing it. So yeah, very excited about that.
So what kind of things, you're treating people that's very difficult. What kind of things have you learned maybe the past 5-10 years that you want to integrate more, with your experience, what has been a learning curve for you, or something that we talk about barriers and breakthroughs, like there's been barriers maybe, and then breakthroughs. So tell us a little bit about that.
Yeah. So I think actually one of the reasons why it took me so long to get to this point is one of my barriers, I would say, would be that I had to learn to be okay with not knowing everything. So that might sound kind of crazy, but when we go through conventional medical training, it's kind of indoctrinated into us that you better know the answer. I mean, literally, when you're a medical student and you're rounding with your staff, if they ask you a question and you don't know the answer,
what?
You get humiliated in front of all your colleagues. So, and also partly just personality, but it's okay to sit with a patient and they ask you a question and you say, I don't know, but let's try to figure this out together, And so I think once I realized that I had the freedom to do that, you have more genuine interactions with your patients. They appreciate the efforts that you're making more, and it makes them curious about it as well. And so that was a big one for me.
That's really good. That's really important. Like, it's a team effort. It's not like you're condemning them or judging them, And so so that's a breakthrough. That's really
that was a big one. Other things I guess that I've learned are that's probably the biggest one, I would say.
So there's a lot of us that wish we had a psychiatrist to talk to. I mean, fortunately, we can talk when we're lifting weights, right? But how would somebody know when they need a psychiatrist or when they need professional help?
Yeah, that's a really good question, because I think that a lot of times by the time I see someone, they've been suffering so long and trying so hard to just kind of maintain on their own that they're almost not functioning a lot of times by the time they come in, just from depression and anxiety and stress.
Yeah.
So, I think, some signs that you might need to talk to somebody, whether it be a psychiatrist or a counselor, is if you spend, if a lot of the time you're very unhappy, or, mentally you start forgetting things, or you feel like your mind's not working as well. A big warning sign is when your sleep starts to be a problem. Sometimes people don't like to think about their problems, so they start drinking too much, or other sort of addictive behaviors to try to take their mind off of things. Yeah. When your relationships are really having a lot of problems, that's usually a sign that there's something going on with somebody in that relationship.
In a relationship, yeah. Mm-hmm. That makes sense. Panic attacks. Mm-hmm. I know some of my friends didn't realize until I was, like, one of my girlfriends in high school, her dad passed away, and then all of a sudden she started having panic attacks, and she never had them, but she didn't realize that it had kind of been building up, with her family relationships, and then all of a sudden her dad was gone. She was very close to her dad. Yeah. And then, and she actually became a social worker, so.
Oh, wow.
Yeah.
That's great.
She's the one that you remind me of.
Oh.
Yeah.
Well, see, so, we're in the same profession, so.
Yeah.
I just think, and also if you're thinking about it and you wonder, it doesn't hurt to call up a therapist or even a psychiatrist and make an appointment and say, I'm not sure if I need something, but maybe I do.
So do you get people that maybe if they're in an abusive relationship, like they might be afraid to talk to you, like do you get referrals from hotlines, or they have to want to come see you?
Yeah, right? I don't get referrals from hotlines or from, unless the patient, so for example, someone goes to a women's shelter, if someone suggests to them, hey, get some help, and then they seek it out themselves.
Yeah. So that's good.
Yeah.
So now you're wanting to move into your own, so you're going to move into your own place. Mm-hmm. And so what does that look like if you have a nurse practitioner? What kind of person would be interested in coming? What
sets our practice apart?
Yeah.
Yeah. So I would say, really where we're really different is that, there are a lot of, I would say, good quality psychiatrists out there. But the integrative training puts my focus more on lifestyle behavioral changes that you can make, and I know more about those things than a typically trained psychiatrist. So I'm going to be able to tell you about specific diets or nutrition plans that you might want to use depending on what's going on with you. I can talk to you all day about exercise just because of who I am.
Yeah, we need to break off for a second. Okay, we do have some pictures. Let's go to you're in the gym. Like, I know that helps you, right? Like,
yeah,
it's a good release for you.
Mm-hmm.
So we have a picture of, I went with Becca to a meet, the first meet that I've ever seen, a powerlifting meet in February, and it was, what was it called again? My Dead Valentine?
Because it was on February 14th.
No, February 14th. My Dead Valentine Powerlifting. Okay, so here are these, it was super fun and interesting for me. All different kinds of women, a 72-year-old, and just girls that you wouldn't even think were strong or lifting like a lot of weight. It was super exciting. So, but one thing, you're super strong. Like, that's exciting to see. Like, you're only 125 pounds and you can bench 175. It's just amazing. So actually, we have a video of you. This was your record, right?
Yeah. I think that was 170.8 or something.
Yeah. So that's where, personal record for you, right? PR. So we have that video. Let's take a look at that. I video. Come on. Got it. Here we go. Got it. Come on. Come on. on, you got it. Come on, Becca. Press. Go, 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 go. Yeah, you got it. Woo! Awesome. Yeah, no, that was awesome. We also have a picture of the gals that were there. I think you got the best lifter, and there's a picture of the other gal that was really, the two of you, like you both took first place in your class division. And just, I had fun interviewing the 72-year-old and a lot of really fun girls up there. You got those pictures up, right? Yeah.
And remember, the 72-year-old was setting world records. Every time she did a lift, it was a world record.
It was a world record. I was like, wow, world record. Yeah, I know, that was pretty fun. So I have some hope, you know. I mean, I'm 50, so by the time I'm 72, maybe I'll set a world record. So.
You probably will.
No, you will first, I know. So, but I think that's important that people see, you know, you are very goal-driven. You go through difficult things to meet your goals. And so I think that you bring a lot of that to the table, where you've been through a lot in your life. You've been through trauma. Yeah. And so you understand how that can be integrative is a good way to speak, where you can improve your mind, body, and spirit.
Yeah, for sure. Yep.
Status, right? So, so what's the good way for people to get a hold of you?
Probably the best way is just call the office, and I think you're gonna put our office number.
I think we have, yeah. So Trimera
Health.
Does that mean anything? Trimera?
Yeah, it means 3 parts. So mind, body, and spirit. So that's kind of how we came up with that name.
I like it.
And yeah, just call the office here Monday through Friday. We have staff ready to answer the phone and set you up for an appointment.
Right. So we're also introducing Becca because she also is doing TMS, which is transcranial magnetic stimulation, which you'll hear about that next month. And it's a super exciting. Do you want to briefly just say it in one sentence?
Yeah, it's been around for a while, since 2008, but it's a non-invasive, non-medication treatment for depression that doesn't respond to medicines, and it's got really great results. And it's a wonderful option for people.
Yeah. So we're excited to hear more about that. We'll actually have the machine, and you'll be able to explain more about that coming up in the next time that we meet. So I'm super excited that I hope people will tune in, and you're right here close in Pearland, and people can, what's the typical, do people come for once a week for like 6 weeks? Like what's a typical frequency?
So I mean,
length of time.
I would say, like, if it's someone who's being treated for something for the first time, they'll do usually about an hour assessment the first time, and then we'll decide the treatment approach, and then usually they'll come back like in 2 weeks normally, just to check in again. And then after that, if they're doing well, we make other adjustments. We might stretch it out to once a month for a while, and eventually when people are doing really well, they can come every 3 months and just check in.
All right. Do you also have couples that come in that you do, or is it more an individual? Yeah,
so I don't do couples therapy. I have a lot of therapists that I can refer to. Sometimes couples do come in, though, and they want to just kind of have a session. And so I'll do that with them, and we'll, maybe make a little breakthrough in something that they're struggling with.
Okay.
So, yeah.
So that's really good. So, insurance, you take insurances as well?
We take pretty much every insurance you can imagine, cash pay as well. I have a few people that I see on a sliding scale as well for financial reasons.
Yeah, so you can help somebody that might not have as much resources as they need. So that's great. Well, I'm super excited to have you the next time as well and learn a lot. I've learned a lot just from knowing you, and I've learned a lot today actually, and a little bit more about integrative as well. I'm gonna actually read up on it more because
it's really, really interesting.
I'm interested in it as well. So, And any of you out there that want to contact Becca, I highly recommend her. And I know she's got some good counselors that she works with as well. So check her out, Trimera Help. And if you feel like you're depressed or not happy, like she said, and maybe you're in a relationship that you feel like you're not progressing, but especially if you're depressed and doing addictive things, maybe, drinking or things that aren't helpful for you in your life, then that might be the person that you need to call and get some guidance. And maybe it's just one session. Sometimes you said that you could help them.
Sometimes I'll say, you don't really need my services, but I think you need to go and talk with a therapist for a long term, weekly sessions. So I'll send. But I also want to, can I put a plug in for you?
Oh,
the
sure.
Pain Whisperer. Okay, so she fixed my hip in one session. I had some imbalance in my hips, and so she really is the Pain Whisperer.
It was fun because you tore your hamstring a little bit, and so sometimes people don't check those simple things, but it was a quick maneuver.
Yes.
That then you're back to powerlifting. You're 200-300 pounds, right? So,
whatever. Yeah.
So anyway, thank you so much for joining us on the Barriers and Breakthroughs show. Again, I'm Rochelle Payne-Baum. I've learned a lot today. If you need some psychiatry help, and you prescribe medicine too.
Yes.
Right. So she could prescribe medicine in case you think that you're not getting the right medicine. You can also ask Becca. She knows all about medicines as well. So thank you so much again. And next week, well, before that, I want you to make sure and go to our YouTube channel, Barriers and Breakthroughs. You can see all the past episodes. Search for your favorite topic that you want to read. There's been a lot of great people that have been on, and you can learn a lot from each episode. So I encourage you to go to YouTube at the Barriers and Breakthroughs. Also, next week, we are having John and Jennifer Kahn. John is a personal injury attorney, and Jennifer is also an attorney. She works with him in the practice, so we'll have them on. You can ask all your personal injury questions, car accident questions from them. They're here locally in Pearland as well, so tune in for that next week. And also stay tuned for some highlights that we'll keep posting so that you can get a hold of Becca. So thanks again, and have a good evening. We'll be seeing you next week on the Barriers and Breakthroughs show.
Thank you.
Bye.
Bye.